Okay, thank you, Professor Kang, Dr. Kang, and so thank you, Dr. Jin. Thank you, and all of our audience. My name is Wang Jian'an from Second Affiliated Hospital, Zhejiang University School of Medicine, China. I'm an interventional cardiologist. I'm also the chief editor of JACC Asia. Thank you.
Yes, thank you. Thank you for the kind introduction, Dr. Wang. Well, actually, this is the first restart for the JACC Asia Pulse, and this is going to be the first peer perspective, which we are going to discuss about current hot journals that have been published in the cardiology field. And today we're going to talk about the FLAVOUR 2 trial, which was recently published in Lancet, and before that it was presented as the LBCT in the ACC 2025. So now here, as you've heard, we have the principal investigator, Dr. Wang, and we will have an in-depth but concise interview with Dr. Wang for the details about the FLAVOUR 2 trial. So first, the question is, we all know that the FLAVOUR 2 trial has been published in Lancet, but could you give a short introduction of the main goal of this study?
Okay, thank you for your question. The main goal of FLAVOUR 2 was to compare the clinical outcomes of angiography-derived FFR-guided PCI with IVUS-guided PCI in patients with significant coronary artery disease. Our hypothesis was Angio-FFR would be inferior to IVUS.
Yes, so as you said, angio-derived FFR. We usually call this Angio-FFR in short, but then why was the reason that you decided to compare Angio-FFR versus IVUS? Because these are slightly different parameters that we use in the interventional cardiology field.
Both Angio-FFR and IVUS are used to guide PCI, but they have different strengths. Angio-FFR is a non-invasive physiologic assessment, and it's good for deciding whether to perform a coronary angioplasty or not. IVUS is an invasive image tool, excellent for optimizing stent implantation. So despite Class 1A recommendation for via basic physiology assessments to make a PCI decision, global adoption of these conventional techniques remains low. Angio-FFR is a simplified physiologic assessment and is increasingly being adopted in clinical practice. It already carries Class 1B recommendation. So now intravascular imaging also holds Class 1A recommendation for optimizing coronary angioplasty. So it's unclear if a non-invasive physiologic approach could be as effective as a standard invasive imaging approach for comprehensive PCI strategy, both decision-making and stent optimization.
Yes, thank you for the summarization. To repeat what you said, usually we measured FFR invasively. It needed a pressure wire within the coronary artery. This was not difficult, but obviously it was a slightly cumbersome act that we had to do. But now we can just measure FFR with the routine angiography that we use in the clinic. So it was more easy. It was now more easy to have an Angio-FFR value, whereas IVUS, it has many advantages in optimizing the PCI technique. So as you said, what I think is important is that this is a nice strategy. This is a nice study that could compare strategies for both decision-making and optimization. Yes, so based on this nice hypothesis and this background, could you explain the major findings of the FLAVOUR 2 trial?
Okay, yes, you're right. You know, the FLAVOUR 2 trial was a multi-center prospective randomized control trial. So it was conducted from May 2020 to September 2024 in China. So the major finding was that Angio-FFR guided PCI was non-inferior to IVUS-guided PCI in terms of composite of clinical events, so including death, myocardial infarction, or revascularization at 1 year. As a comprehensive PCI strategy, including PCI decision-making and procedure optimization. So Angio-FFR also lead to fewer PCI procedures and the stent implantations.
Okay, so Angio-FFR was non-inferior, but led to fewer PCI procedures. So when we say Angio-FFR, as far as I know, there are multiple Angio-FFRs. There is the QFR, there is the VIEW-QFR. Then in our study, as far as I know, VIEW-QFR was more oftenly used compared to QFR. So can you explain the reason that you used the VIEW-QFR more oftenly?
You know, as we know, QFR is the first generation Angio-FFR and calculates FFR from multi-view coronary angiography. So it takes a longer time and it has bigger variations among different detectors. Mu-QFR is the next generation QFR technology. So it is also an AI-enhanced algorithm, so which enables a more automated, rapid, and reproducible FFR computation from only a single view angiogram.
Yeah, so then only with a single view angiogram, we can have the FFR value within the cath lab almost simultaneously, right?
Yes.
Yes. So
almost simultaneous.
Yes, that's a very nice advantages in having the single FFR value. So then now we know that we have the results of the FLAVOUR 2 trial. Then when and how should we use this Angio-FFR or IVUS in the clinical practice that we do in the clinic?
Thank you for your excellent questions. So based on the FLAVOUR 2, I think the Angio-FFR can be used in patients with non-complex coronary artery disease because it was shown to be non-inferior to IVUS and potentially reduces PCI burden. So to be noted, it must be used maximally, including both decision-making and optimization. So IVUS remains a valuable tool for optimizing PCI procedures, particularly for complex lesions or when detailed anatomic information is crucial.
You explained it very nicely, but what blinks in my thought is that recently there was the FLAVOUR 3 Europe trial, right? In that study, well, surprisingly, Angio-FFR failed to demonstrate non-inferiority compared to FFR in that study. So how could Angio-FFR achieve non-inferiority compared to IVUS when it's compared to the FLAVOUR 3 Europe trial?
FLAVOUR 3 Europe trial actually is a very good milestone trial. However, FLAVOUR 3 Europe trial primarily focusing on treatment decisions and did not mandate stent optimization using QFR or FFR. So the author mentioned unfavorable outcomes related to the higher PCI rate in QFR group. However, it would be totally different if optimized those procedures. So FLAVOUR 2 trial was designed not only to investigate the clinical efficacy of Angio-FFR for PCI decision-making, but also to evaluate its prognostic role in stent optimization. So FLAVOUR 3 Europe adopted the conventional QFR to address the limitations of conventional QFR, such as restricted feasibility due to the need for two angiography projections and operator variability from manual input. So we use the next generation QFR technology, Mu-QFR.
Yes, so as you said in your previous speech, you said that this study was not only a comparison of Angio-FFR versus IVUS, but it has the concept of decision-making plus optimization. And in the current era, we all know that it's very important to decide whether or not to stent this patient, but also it's very important if we decide to stent this patient, to stent this very optimally, which we call optimization. So one of the bright sides of this study, of the FLAVOUR-2 study, might be that it combined decision-making plus optimization, which is very important in the current field that we have. So then going back to the FLAVOUR-2 trial, how can this affect our clinical practice that we do right now?
FLAVOUR-2 suggests that Angio-FFR guided PCI can be a safe and effective alternative to IVUS-guided PCI, particularly in non-complex coronary artery disease. This could simplify decision-making in coronary interventions, potentially leading to fewer invasive procedures and reducing costs. So while maintaining comparable clinical outcomes, it may contribute to a future guidelines regarding PCI guidance strategies.
Yeah, so one of the keywords that you just said is the future, because right now we had the FFR, invasive FFR in the past. We now have Angio-FFR. As you said, the VUE-QFR is the second generation, but obviously this is not the end. We might have a third generation, fourth generation, etc. Probably IVUS might evolve in somehow. So then in this regards, can you provide any future perspectives regarding the field of non-invasive, non-pressure wire-based physiologic assessment?
Oh, thank you for your wonderful question. In the future, I think there are several important points. First, increase the adoption. So simplification and reducing the invasiveness of these techniques could increase their use in daily practice, overcoming barriers of traditional wire-based FFR. The second, integration with imaging. Further integration of physiologic assessment with imaging modalities, potentially creating more comprehensive and efficient assessment tools. Third, AI advancements. Continued development of AI-powered algorithms to improve accuracy, speed, and automation of these assessments. Fourth, long-term outcomes. Ongoing research, like the long-term follow-up of FLAVOUR-2 to confirm durability of outcomes and identify any long-term differences. Last, complex lesions. Expanding research into the efficacy of these non-invasive tools in more complex coronary lesions. So that's my perspective about the future of the Angio-FFR.
Yes, well, thank you. You nicely summarized our future way. So as many studies are as it is, the FLAVOUR-2, the results are very nice, but it gave us future perspectives of how we should and what we should research in the future. And I think that a nice study gives us more homework that we should do in the future. And that's, I think, what the FLAVOUR-2 trial has provided us. It provided us with an answer, but also with a future direction of the following research that we should have to do. So lastly, as the editor-in-chief of JACC Asia, as you know, that we're relaunching this Asia Pulse. So could you give any speeches to the junior audience that are listening to this this session right now?
Okay, thank you. Actually, the JACC Asia Pulse, is a very important platform to nurture young talents in cardiovascular field. I hope more and more the younger cardiovascular investigators and fellows to join us and to review the video provided through the important platform. Also welcome you to provide your material, like the short video, maybe, for your hands-on skill to show us some of the important procedures. So all very special cases. So I think the JACC Asia Pulse belongs to ACC, belongs to JACC, but most importantly, belongs to young cardiovascular investigators and fellows. So it's also your platform. Thank you.
Yes, well, thank you, Dr. Wang. We had a wonderful summarization of the FLAVOUR trial, and most importantly, Dr. Wang gave us a very nice encouragement in the future cardiologists, the potential audience of the JACC Asia Pulse, who are the young generation, people who are in their early field of their career. So thank you, Dr. Wang, once again. And
thank you.
I hope that everybody has enjoyed this video, and this video is not the last, it's just the beginning. And the following videos that will be in JACC Asia Pulse will be more and more interesting, and I hope that everybody enjoys it. Hope to see you again. Thank you, everybody.
Okay.
Bye.
Thank you. Bye-bye.